Hi, this is Siddhi, and today we are going to talk about communication and what are the factors that predict communication outcomes. Okay, so what communication outcome do we want? We want spontaneous communication. We means we want the child to be able to understand that if he wants something, he has to be able to use the right words to be able to get his point across to the other person and to get what he wants. Okay, so where so we talked about the fact last time that development happens in stages, and the techniques that we use to teach communication, each technique has a prerequisite that is required. If it is present, then we can use that technique. So say for example, the three different prerequisites that we look at are: number one, echoics, fine motor, or object exchange. So when there is echoics, which is like the most easiest one, when there is echoics, generally the therapist will use speech as a goal for the child to get communication. So that means that if the echoics is present and I want the child to use speech, I will say that the child has to speak to get what he wants. So if echoics is present and I want the child to ask for bubbles, I want him to say bubbles and then I will give him bubbles. Okay, but if echoics is not present, which is what happens with many children, many autistic children, then the next thing that the therapist will use is signs. Okay, so he or she will teach the child a sign to ask for what he wants. Okay, now to teach a sign, typically the prerequisite that the therapist will look for is the child able to imitate a sign, or does the child allow his hands to be molded in such a format that we can teach a sign. So, say for example, if again I want the child to ask for bubbles, then I will make the child do bubble sign and then I would give him bubbles. Okay. Now, if the echoics is not present and fine motor imitation is not present, typically the third thing the therapist will look at is whether the child has object exchange. Object exchange is when the child uses an object to communicate what he wants in a natural environment. So, say for example, he's hungry, you'll see that the children will get a plate. He's thirsty, you will see the child will get glass. Okay, so when you have these prerequisites of exchanging object to get something, then the therapist will typically use PECS or ASC as a way to develop communication in the child. Okay, now if the therapist is not familiar with ASCs and PECs, most of the time they would not work on, and if there is no echoics and fine motor imitation, most of the time they would not work on communication and they would just work on receptive language. Okay, so this is a basic idea of what therapists would do typically in ABA and in speech to get communication out in the child. Okay, but when I work with autistic children, I don't limit myself to these three, because what I've found over the years is that there are other factors also which affect communication, functional use of communication, and which require to get those factors to be covered, which require different techniques to be used again. Okay, so what are the factors that I look at when working with children with autism? So one of the first factors that I look at is social attending and understanding. Social attending and understanding is the ability to understand that there is communication, which is the ability to see this process of communication. Means the process of I am thinking of the apple. I have to break up the symbol apple. Then I have to look at the person. I have to say the word. When I say the word, the person hears, then he forms the image in his head. This process, and I have to do this with eye contact. This process is something that is is most is deficit in all of the children on this autistic spectrum. But there is a small portion of children on the autism spectrum who, if the carer or the therapist starts taking a little bit more effort, you will find that they will pick it up faster. They will pick up speech faster. But most of the time, this is the area that this is the area that is affected, because the small percentage that we are talking about typically don't really attend therapy as much. They barely attend maybe 1 or 2 months of therapy and then they go off after that. Okay. Now, if I want to teach this process of communication, I have to make this process visualize. I have to make this process visual for the child. So the way to make this process visual to the child is to use pecs. Okay, so the child can see that I am giving something, the person is looking at what I've given, the person has heard the word, and now he's giving me something. That process, that back and forth, is called social awareness. And here you're using pecs as a teaching tool, not as a replacement of speech. Okay. Second is in conjunction to the first point is what kind of a learner is the child? Is he a visual learner? Why is this important? Because typically visual learners tend to gravitate towards things, images, pictures more than to people. So they are not, again, they are going to be the population which is going to miss that social cue, and they won't understand how to, that you have to talk to the person. So here you will find these are the people who typically will do have speech, but they will probably not address themselves to a person. So they will not go close to the person and talk to them. They will not get eye contact from the person. They will just say the word and help the expect that the adult is going to catch the word and use it by themselves. So you will find that even though they do have speech, they are not functional. So here again you will find that pecs becomes useful, because it becomes useful, to show the process of communication, and it also becomes useful because the child will learn the words for communication faster if there is a picture involved. So say for example, if the child wants, say, the numbers, the child will say the number faster if the number is in front of him, rather than getting it out of his mind by himself. Okay, so if I have a PEX card, or I have Ava's app, and I get the child to choose, the child will choose faster than just answer the question of what do you want. Okay, or come up and say I want puzzle. All right. Third is thinking. Okay, how much comfortable is the child with thinking? Now, thinking is something that gets neglected in most of the therapies, because we tend to ignore the fact that communication is a process. It is not a singular activity of just saying the word. Okay, communication involves identifying what is your internal state, then thinking of the right word for it, then getting the attention of the person, using the right word, waiting for the response. Okay, throughout this process the person has to stay on task. He has to think multiple steps. All right. And this thinking, planning, executing is something that many children on the autism spectrum have difficulty with. And because they have difficulty with it, you do find that you do have communication coming up, but the communication is rigid. Like, say for example, one of the experiences that I had with one of my kids a lot was, one of my kids used to, when I did my initial assessment with the child used to ask for a particular vehicle, and I thought that that's what he loved. The parents said that that's what he loved, and I was happy. I was fine. He would ask for it, I would give it to him, and he would play. A few years down the line, I found that he would ask for it. I would tell him that, okay, I will give it to you after you finish with two things in the activities that I've put. And the child, my expectation was, since I've put it as a reward, the child is going to do the activity and then, get the toy. But I found that that didn't really work. The child still didn't do the activity. Many a times, even if I pushed the child and made him do the activity and I gave him the reward, the child didn't seem to play with it. He didn't seem interested. So I was stuck because I didn't understand what was happening. And that's when I was like, I told the child, I actually went back and I told the child, I don't think you want this vehicle. Look at the other choices. And when I told him, look at the other choices, then he went off and picked something that he wanted. He went through this process of, taking his pattern things, and in that process he picked the thing that he really liked and he played with it. So what happened was that the communication, even though it was technically there and he was a verbal child, the communication was patterned, so it actually did not reflect what was there inside him. He was not thinking about what he wants and what he enjoys. He was just thinking about Siddhi auntie's class is equal to the vehicle, or toy is equal to the vehicle, which is not what communication actually is. Third, other problem that you find many a times with kids on the spectrum is retrieval issues. Okay, retrieval issues is when, if you see that the child understands what the object is. So there is an apple, I want to eat it. Understands the image apple, has the image in his head, but what he doesn't have is the word. The word apple does not retrieve, it does not come out. Because the word apple does not retrieve and does not come out, that's the reason why the person does not speak. So children who have retrieval issues typically are not always non-verbal. They are verbal, but you will find that the protocol with them will be that they are able to understand the word, so but they are not able to speak it out, or they are not consistent with speaking out. Consistent is a word that comes up frequently with children who have retrieval issues. And the consistency drops when the child is anxious, the child is stressed, the child is sick. Okay, so again, when you have retrieval issues, the temptation is, if you look at the basic ABA methodology, it will be like, okay, fine, he can speak, you force him to speak. But this actually does not work with children who have retrieval issues. The better way to work with children who have retrieval issues is to give them an ASE, let them, calm down, use it, and you will find that they will feel less stressed, and then the speech will come out by itself. Okay, so here the ASC is like a backup system. It's not the first tool, but it is not a replacement, but it is a backup in case the speech fails. Okay, choice making. Now, communication by definition involves choice making. Okay, and as let's go back to the example that I have had with my boy. So with my boy, what happened was that he was not making the choice, right? So he had formed a sort of a unidirectional thought process that if I want to play is equal to I want a car, but that was causing a problem because he was actually not looking at all of the choices, thinking about what he wants, and then choosing according to it. So there's a awareness of internal states. There's a thought process that goes in your internal level, which is choice making, which autistic children are not able to do. So even if they are verbal, they are not always able to do choice making. Like, they are not able to understand what is it that they want. Okay, and if they don't understand what they want, what's going to happen is that you give them, which is what happened with my boy. I gave it to him, but he actually didn't play with it. Okay, he would throw it, he would break it, he would not actually engage with it till the time he actually found something that he wanted. But the process of finding something that he wanted was a laborious process. Now, what happens most of the time with parents is that the child will take the car, will not play with it, take the ball, will not play with it. And after one or two no's, then the child will get frustrated, and then the parent will draw a conclusion that the child doesn't really want anything, which is not true. What you require is a visual tool which will show him all of the choices, and he will, in the process of making the choices, he will understand what does he like and what he doesn't like, and in that way actually develop spontaneous communication which reflects what is there inside him. Okay, the other factor that is very important is the age of the child. Okay, so like we talked about last time, a typical child who has object permanence will start using symbols as a way of communication around 1.5 to 2 years of age. So because our children do not figure out the symbols aspect of communication, they don't pick up the theory of mind and the symbols aspect of communication, they are deficit around this age. But if we replace that by using ASCs or by using speech, what happens is that the children will pick up the right way of communication, and they will go ahead quite well without any frustration or anxiety. However, what happens is that if you do not intervene at that time and teach them the right communication technique, and you wait, what will happen is the child and the parent is going to develop faulty communication patterns. So, faulty communication patterns could be the child doesn't ask, just takes for things. The child grabs the parent, the child pulls hair, the child hits the parent, the child runs away. You know, now if and when we decide to change the pattern, what's going to happen is that we will have to break these faulty patterns and replace them with a correct pattern. Okay. Now, this is a big problem for children on the spectrum, because children on the spectrum don't like changes. So they like to learn and they like to stick to it. So what happens is that uh, that changing which is required, because what is accepted when the child is 2 cannot be accepted when the child is 6, 7, 8, 9, or 10 or 15. That change and that breaking of the old faulty patterns causes a lot of anxiety in the child, and it makes the teaching process very frustrating and difficult for the parent. And at the end of the day, it requires a lot of work. If I have to teach a 2-year-old child communication, it can happen within a month or 2 months. But if I have to teach a adult on the older child, like anything above 6 and 7 years of age, typically that would mean that it will take a longer time, anything between 3 months, 6 months, or a year plus, with if the parent is consistent about it. Okay, so the age is a big factor when you're looking at communication output. Okay, the other area that you have which affects communication is apraxia. Apraxia is basically where you have the child understands the thing what he wants. Okay, the image is formed, the word is also formed. What is the problem? The problem is that the child is not able to speak it. Okay, so the apraxia is basically motor planning issues in the oral area. Okay, the ground rule for apraxia is to use ASCs, because apraxia is very, very, very difficult to resolve. And if you push a child with apraxia to say that you have to only speak, then you actually get a backlash, because what happens is that the child will speak, but even if he speaks, then only a limited number of people will understand, because apraxia doesn't get resolved that easily. And the child speaks only limited number of words, so there's a gap between the child, what the child can speak and what the child can feel and think. Okay, and the whole process is very anxiety provoking and very stressful, so the child basically is not happy about communication. Okay, so the ground rule for someone, a child with autistic child with apraxia, is you typically go for ASC, and then on that you can work on clarity of speech, but you don't directly expect clarity of speech. Okay, the other aspect that you find frequently is contributes to communication issues is listening. Okay, so what do I mean by listening? We talked about, when we talked about sensory issues that we see in children with autism. One of the sensory issues that we see with children with autism, is a delay of auditory processing. So what do I mean by delay of auditory processing? So if you see, the child has looked at the apple, but the word apple has gone into his ears after some time. So that's the reason why there is a delay, there's a lapse. So there is no pairing happening. Pairing will happen if they see the apple and they hear the word at the same time. So when there is no pairing, it's difficult for the child to use the word to communicate. Okay, so that's one way. The word will just not go inside in the way we want it. That's the reason why you'll see a lot of the times your children will be speaking the words, but they will not be able to use it in the right place to communicate. Another way the listening affects is the actual listening of the sound, and this is where it gets confusing with the children with apraxia, because here again you will have clarity issues just like with children with apraxia. Okay, so what happens is the child sees the word, object, he hears the word, but what he hears is he does not hear the complete word. He just hears a sound. So he'll probably hear the first sound, he'll probably hear the last sound, or he'll probably hear the first and the last sound. So the output behavior will also be that. So if I've just heard a, and then I'll say apple like that. So I've heard apple, but I've not heard apple, which is the clarity part, that which is what I require to be able to speak clearly. Okay, so again, this affects the output behavior, functional communication. Okay. Sensory response to environment. Now, one thing to keep in mind when you have autistic children, and even if you have a verbal child with on the autism spectrum, even if you have a verbal autistic child, then if the child has a tendency to get overstimulated by environment, you will find that the communication will drop, the speech will drop when they're outside. Overstimulation, so you'll find that they are not able, even though they are, so this is where you see a lot of this in level ones, where you have these really verbal children, they are very verbose, they're talking, they're conversing, but the parents will say that he got upset and that he couldn't talk. Okay, so this is overstimulation. Overstimulation can be from inside the environment, inside, because you are stressed physically, like I'm sick, I'm tired, or I am burnt out. Or it could be from external, like I'm in a birthday party, it's too noisy, I'm getting overwhelmed with the noise and the balloons and with the people talking. So again, one needs to look into it and one needs to work with it. The technique would you know be a combination of what the child actually has when he's calmer. uh, so it's kind of difficult to pick one technique to resolve this issue. Okay, the child's ability to generalize. Now some children, like again, like the ones we talked about who have social awareness, okay, some children those children will also be able to understand that if I have to communicate, ask, I have to use words to share my thoughts, they will be able to take that from one place to another very easily. So these are the children who, whether speech or whether AAC, will be able to use the AAC, use the speech or the AAC by themselves across environment. So they will not just do it with their mother, they will also do it with their granny, they will also do it with their teacher, they will also do it with other people, with minimal effort from the therapist or the carer. But keep in mind, again, generalizing is a core deficit in autism, so it happens only with a very small portion of children. So that's the reason why you will find many children who will be able to use communication in one place, like with mother 100%, but will not use it with the father, will not use it with the grandmother. So if generalization is of communication is a problem area, then you need to make active efforts to make sure the child has opportunities to generalize. Okay, next is child's interest in communication. So now this one is something I always love to tell my parents about, how I came to this insight. So I attended a lecture given by somebody who had cerebral palsy, who had only control over one, had very minimal control over his body, and he was using a combination of typing using a toe, gross gestures, with one arm or two arms, and cards. Okay, and I was amazed because this person was so vivacious. He was so engaged with people, even though he had so many challenges. And I was really amazed, and I was very, very, awed by the fact that this person could do this much. And then I came back and I was thinking about my kids who don't have any gross motor issues to that level. And I'm thinking, why my kids are not doing that. That's when I realized that one of the big issue with autism which is a big challenge for parents and for carers, is that there is a deficit in interest in communication. So, autistic children, by definition, will want to take things by themselves. Okay, so they will only come to you when they can't take things. Okay, that's the difference between autistic child, a big difference between autistic child and a typical child. Okay, so if you have a child who prefers to take things and not communicate, then you have to make an extra effort to get them to realize that they cannot just take things. Okay, so which means that you have to, as carers, you have to make an extra effort to make sure that things are not easily accessible, to make sure that you create hurdles for them so that they are forced to communicate. You don't respond in a patterned manner, just because every time I say yes, that's the reason why I have to say yes every time, that sort of a thing. So that the child understands that communication is not a choice. I have to use the communication to work with people. Okay, I cannot just go off and take things. And this is something that is very difficult for therapists to do in therapy room, because they are limited to a therapy room. But more than that, if the therapist has not extrapolated that information to the parent, and the parent doesn't understand how to do it, you will form a faulty pattern where the child will not understand communication and will basically, even if you do all of the speeches there, or the ASC is there, or the signs are there, if the child is not shown that you have to use it, the child will not use it. It's as simple as that. Okay, the other area that is important to consider is which was a therapy technique that was used first. So typically, adult-led therapy techniques tend to create compliance, okay, and create a feeling in the child's mind that what he or she wants is not of importance. What is important is what the adult wants. Okay, once that sort of a thought process develops in the child becomes submissive, and the child will not communicate what he wants. So if this is a problem, you have to literally work doubly to get the child understand that I am interested in what you want, and get the child to say it. And this is where I differ. If any of the parents who work with me, especially in the recent years, they will tell you that unlike in the traditional ABA, where the tendency is that if you have a behavior, you block it and you force the child to do it, I would typically ask the child first, what is the problem? And then I would tell the child, I'm not bothering with you, or I'm not accepting that, or negotiate with the child. But I will still finish the work that I'm supposed to be doing. So the impression that I always tell my parents is that you have to tell the child that I want to know what you want to say. If I listen or not is my choice, and I will evaluate it on the basis of what I want from you. But I definitely want to listen. That impression has to be given. If that has not been given, again, your communication is going to be affected. Okay, last is, what are the opportunities given for communication? So communication is because it is typically something that is it uh, ideally it should be used 24/7. The hours that the child is awake, you should have communication. But that is typically something that doesn't happen, because parents, therapists, they tend to sort of get blocked into this therapy technique, therapy hours bit, where they're like, okay, fine, I'm going to do 1 hour of communication, 2 hours of communication. Communication doesn't work that way. Communication only works if you create opportunities every minute of the day for the child. The more opportunities that you create, the more the child will understand that, okay, I have to communicate in this format. And again, this is where you see the difference between autistic children and other people who have disabilities. Like, you would never have a hearing impaired child, or a child with cerebral palsy, or a child with Down syndrome, the parent going off and saying, oh, you have to only speak in therapy room. No, they will be using it everywhere. They will be using signs everywhere. They will be using, app everywhere. This is a difference between autistic children and non-autistic children with language and communication issues. So the more opportunities you create, the more, if you have faulty patterns where you don't expect the child to talk, you're fine with the child, pulling your hair, shouting at you, crying, screaming, hitting you as a way of communication, you're never going to get the child to communicate. The child will continue doing that. Okay, so if you in the end, what you need to understand is the communication is not as simple as just echoic signs or pecs. It's a process. It has many factors associated with it. It's literally, you have to think, you have to identify your internal state, then you have to think of the choices, then you have to choose something, you have to think about whether it's available or not, can you get it, how to get it, it's a process, and this process is a very complex process that requires attending on a longer period of time. Okay, so but if you don't cover all of these aspects, you will not have functional communication which is spontaneous. All right. So that's it for today. I will see you guys next week. Thank you.